Pelvic Ultrasound report of miscarriage. Miscarriage or pregnancy loss is the spontaneous loss of pregnancy before 20 weeks. After 20 weeks, it is known as intrauterine fetal death. The diagnosis is made by accurately measuring the crown rump length and the mean gestational sac diameter. The current guidelines for diagnosis of miscarriage is based on the measurement of the crown rump length and the mean gestational sac diameter. If the crown rump length is greater than 7 mm and there is no embryonic cardiac activity, it is known as missed miscarriage. If the mean gestational sac diameter is greater than 25 mm and there is no yolk sac or embryonic pole, it is known as empty gestational sac or anembryonic gestation or blighted ovum. The gold standard for diagnosis using ultrasound is transvaginal ultrasound. Missed miscarriage. The clinical presentation includes cramping, vaginal bleeding. The image on the right is a case of missed miscarriage. The embryo seen within the gestational sac shows no cardiac activity. On transvaginal ultrasound, a non-viable fetal pole with a crown to rump length of 9.8 mm was seen, which is consistent with a gestational age of approximately 7 weeks. Here is the video. You can appreciate the fetal pole and there is no cardiac activity seen. On color Doppler interrogation, no flow was seen within the embryo. The features are consistent with missed miscarriage. An embryonic pregnancy, previously known as blighted ovum, is characterized by a gestational sac that forms and grows while an embryo fails to develop. It has the clinical presentation of cramping and vaginal bleeding. However, it can also be silent with no symptom. An embryonic pregnancy is diagnosed on ultrasound scan when no embryo is seen in a gestational sac with a mean sac diameter that is greater or equal to 25 mm. The image on the right is a transabdominal scan demonstrating an embryonic pregnancy. It revealed an irregular in shape gestational sac without a fetal pole or yolk sac, and the mean sac diameter measures above 25 mm. This is the video demonstrating an embryonic pregnancy. The walls of the gestational sac are irregular, thin, and it is empty. No yolk sac or fetal pole is seen within it. This is a typical case of an embryonic pregnancy. Incomplete miscarriage. Incomplete miscarriage is described as partial loss of products of conception within the first 20 weeks of pregnancy. The clinical presentation includes lower abdominal pain, vaginal bleeding, which can include ejection of fetal body parts or tissues, and cramping. The image on the right shows incomplete miscarriage. The endometrium is thickened with irregular outline measuring 22 mm, and the arrow points at the echogenic tissue collection seen within the endometrial cavity. On color Doppler interrogation, mild flow was seen within the tissue collections. Here is the video. You can see the endometrium is thickened, heterogeneous with irregular outline, harboring echogenic tissue collections and some fluid collections too. A typical case of incomplete miscarriage. Thank you so much for watching. Please subscribe to our channel to support what we are doing.